Okay, class, what we're going to look at is the electrical conduction and EKG. Now, the electrical conduction I did mention in a previous video, but let's just do a quick review of that, okay? Can't hurt. So here in the right atrium, right here, is what we call an SA node. The SA node stands for the sinoatrial node. This SA node is also known as the pacemaker. So when you have heard of people that have a pacemaker, this is what they're having replaced so that there's an artificial conductor that has the ability of relaying information, electrical, chemical current into both the right atrium and the left atrium at the exact same time so that both atriums contract in sync, a functional synctium or syncytium, and harmony at the exact same time due to those gap junctions and those intercalated discs. The current is then relayed to number 2, the AV node. AV stands for atrioventricular node. It's right there between the atrium and the ventricles. So it relays it here. That's the second pit stop. Then the electrical current is relayed in the interventricular septum, right here to this dilated portion called the bundle of His. The bundle of His. Now the bundle of His is going to branch into a left and a right bundle branch. And again, these bundle branches are hidden in this muscular wall, the interventricular septum. But what we start to see is that off of those bundle branches, off of the left and right bundle branch, we have these extensions coming off of them called Purkinje fibers. Now remember, the ventricles contract from inferior to superior, so we have to hide that electrical chemical message in the muscular wall until it makes it all the way to the bottom, and now we can extend these fibers into the myocardium of the heart, where we have these papillary muscles and chordate tendineae, right? So now the ventricles can contract, pushing blood upward so that these AV valves close, so that the tricuspid valve and mitral valve close. And as blood is forcing upward, it will then force the semilunar valve open. Okay, so from the left ventricle, this is the aortic semilunar, this is the ascending aorta, the arch of the aorta, then the descending aorta. Okay. Now, this is a little step-by-step that follows along with this. Okay, so it tells you the sinoatrial node is the pacemaker. The sinoatrial node depolarizes. You're going to hear terms of depolarization and repolarization. When things are depolarizing, they're contracting. When they're repolarizing, they're relaxing. Okay, keep that in mind. So we have depolarization, the D for depolarization, and the R for repolarization. When you're depolarizing, the heart's contracting, we call that systole. Systole or systole. During the repolarization, that's called diastole. Diastole. So during depolarization, that's called systole. During repolarization, it's diastole. When we take someone's blood pressure and we say it's 120 over 80, and it should be less than 120 over 80, that's systolic pressure over diastolic pressure. The pressure at its greatest during contraction compared to the pressure in the venous system during relaxation. Systole over diastole, 120 over 80. Okay, so those are these steps. I'm not going to read them to you, but when you have the PowerPoint, you can go through them. But what I want to point out to you is the EKG in relationship to the electrical conduction system. So here we see atrial depolarization. So if the atrium are depolarizing, what is depolarization? Dipole. And what is repolarization? Let's just put the key here. So depolarization, we said, was systole. And repolarization is diastole. Depolarization is contraction. Repolarization is relaxation. Okay, so repole, R&R for relaxation. That's the rest. Dipole, we're contracting, systole. So during atrial depolarization, when the atrium up here is contracting, right, when that SA node fires and it contracts, you get this little bump. You get a P wave. That's called a P wave. When that electrical conduction is relayed all the way down to the ventricles, and the ventricles contract, that's called ventricular depolarization. Which is working harder, the atrium or the ventricles? The ventricles. So look at the ventricular wave, QRS wave. So the P wave here, that's measuring atrial contraction, atrial depolarization. The QRS wave is measuring ventricular depolarization. And then the ventricles have to recover. They have to recover, so they need to rest. That's ventricular repolarization. You get a little bump on that. Okay? You get a little bit of a bump. So we have a PQRST wave. PQRST. The P wave is atrial depolarization. The atriums are contracting. The QRS wave is when the ventricles are depolarizing or contracting. And the ventricle repolarization is when they're relaxation. The ventricles are relaxing. So a cardiologist can study these waves, and these waves tell them functionally what's happening in this conduction pathway. And it can tell them if something is misfiring, it can tell them if someone's having a heart attack, it can tell them a lot of information. So here, let's say an MI, a myocardial infarction, this is normal right here on the left. This is your P, Q, R, S, T wave, PQRST. Okay. Now, with an MI, with a myocardial infarct, meaning that there's lack of blood flow to a specific area of the myocardium, so it's a myocardial infarct, is when there's lack of blood, lack of oxygen, the tissues die. That's an infarct. It can show up with an inverted T wave, which we see here, with ischemia, lack of blood flow, an elevated ST segment, which we see here, if we look at the PQRST wave, or a significant Q wave, which is right there. That would be an infarct due to necrosis, dead tissue, necrotic, necro, black tissue, and that's what it actually looks like. That's what a myocardial infarct looks like. Okay, when we come back, we'll just talk a little bit about blood pressure